Hey, you look so damn tired. Really serious, man.
Yeah, I'm up all night arranging. She comes late, man. She becomes so hyper active. 2 months ago, she came to me, but suddenly now becomes so active. I don't know what to do with her.
No, okay, what? Never be better. I got so many ideas right now, you know. Finish the assignment by today, launch my new business, and maybe do some dance classes. But stick to one thing only, right? I will finish this assignment tonight. But stick for what? This time only, so many things to do, bro. So I can do everything. But maybe you can give me some advice, ma. Which dance I should attend? K-pop, ballet, or
We totally out. She's like totally.
Hey, it seems like your brain is going 200 kilometers per hour. It's impressive, but maybe talking to someone will help just to figure things out. I have this questionnaire that maybe can help you out to figure things out a bit.
okay lah. Since you ask so nicely, I'll try it later. But after I finish my test, okay? But then maybe I'll become a CEO already.
The previous acting scene was a glimpse of someone with bipolar disorder, which is a condition characterized by extreme mood swings between high energy and deep sadness. Now, let's get into bipolar disorder in more detail. So, what is bipolar disorder? Bipolar disorder is a chronic mental health condition marked by extreme mood swings, including manic or hypomanic episodes and depressive episodes. These mood shifts can affect energy, behavior, and daily functioning, which will make it challenging to maintain normal routine. Moving on, there are three types of bipolar disorder. Firstly is bipolar 1, which includes many episodes lasting for 7 days or requiring hospitalization, followed by depressive episode lasting for 2 weeks. Next, bipolar 2 involve depressive episodes with hypomanic episodes but no full manic episodes. Lastly is cyclothymic disorder, which is a milder mood swings with hypomanic and depressive symptoms lasting 2 years or more. So, what are the causes and risk factors for bipolar disorder? Firstly, it can be due to genetics, where it often runs in families with a higher risk for those with a first-degree relative. Secondly, brain structure and function, where the differences in brain structure and functions are observed in imaging studies. Thirdly is environmental factors, where stressful life events, trauma, or substances misuse can trigger symptoms, especially in those genetically predisposed. You have seen a few symptoms of bipolar disorder from the acting scenes, and now let's get into it in more detail. Firstly is mania, where patients experience elevated mood, increased energy, rapid speech, and impulsive behaviors. Secondly is hypomania, which is less severe than mania with no major functional impairment. And thirdly is depression, where patients feel sad, hopeless, exhausted, and loss of interest in doing activities. And in severe cases, it can lead to suicidal thoughts.
You might wonder what the latest statistics of bipolar disorder are and how many are diagnosed in the world. According to WHO, there were approximately 1 in 150 people living with it in 2019. It's very common among adults and youth. Little did you know that females are more common than males, as shown in the pie chart. Look at the global prevalence between 1990 and 2019. You can see that the global prevalence has surged by over 50%. These alarming trends remind us of the urgent need for increased attention and intervention. How about the statistics in Malaysia? According to the Malaysian Psychiatric Association, approximately 1 in 100 individuals suffers from this condition. Usually, the onset of PD begins in the early adulthood, often between the age of 18 to 35. When comparing the statistics between bipolar disorder type 1 and type 2, according to the World Mental Health Survey Initiative, BD type 1 has a higher prevalence than type 2. Overall, both BD1 and BD2 are more common in females. As of the mean age of onset for illness, BD type 2 is generally later than type 1. In terms of risk factors that were identified through previous research, those with more frequent mood swings are more likely to experience BD. Those having difficulty with their social, emotional, and cognitive functioning have higher risk for developing BD compared to other secondary risk factors. Regarding substance misuse, cannabis consumption, also known as marijuana, has a higher likelihood of developing BD compared to alcohol. Bipolar disorder causes them to experience a year of more reduced health due to the associated burdens such as substance abuse, legal issues, even suicide. As a result, their overall quality of life is reduced. It can be observed from the increase in the DALY, as shown in the bar graph, particularly among males.
So, what were the measures taken to address the rise of bipolar disorder? Firstly, the National Mental Health Strategic Plan for 2020 to 2025 was implemented. The main goal of this plan is to strengthen mental health surveillance in Malaysia by improving and increasing data collection on bipolar disorder. This will enable a better understanding of prevalence, incidence, and distribution of bipolar disorder in the population. Besides that, the Malaysian Clinical Practice Guidelines for the Management of Bipolar Disorder in Adults were designed according to global guidelines. For example, the criteria for diagnosing bipolar disorder from the 10th revision of International Statistic Classification of Diseases and Related Health Problems, or ICD-10, and the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, were used. These internationally recognized manuals provides evidence-based recommendations and good practice points to be used by Malaysian healthcare professionals. Moreover, there is an upturn in research in Malaysia concerning the pathology and treatment of bipolar disorder. For example, a study in Malaysia found that DNA damage may be associated with the transition from ideation into suicide attempts in bipolar disorder patients. However, further studies are needed to assist in the early detection and prevention of the progression of suicidal behavior in bipolar disorder.
Hi, I'm going to talk about the medical treatments for bipolar disorder, which can divide into three categories. Firstly, antipsychotic medication, which are haloperidol, olanzapine, and quetiapine, help control psychotic symptoms such as hallucination, delusion, or mania symptom. Then, for antidepressant, such as citalopram, fluoxetine, and sertraline should be prescribed along with a mood stabilizer or an antipsychotic medicine. Mood stabilizer, like lithium and valproate, help reduce mood swing and prevent manic and depressive episodes. And also, girls and women who are pregnant, breastfeeding, or have childbearing potential should avoid consuming. Do note that the medical treatment are personalized, so finding the right medicine will take trial and error, as sometimes 2 or 3 medicines are used at the same time, or some medicines need weeks to months to take full effect. Patients should note that the importance of adherence, like taking a medicine even when you feel better, or else your symptoms will come back. You should also contact a provider if you have any concerns about the side effects of the medicines.
In addition to medical treatments, bipolar disorder can also be managed through non-medical approaches. One such method is the interpersonal and social rhythm therapy, which focuses on establishing and maintaining regular daily routines. So this includes consistent sleep, wake, and meal times, all aimed at stabilizing mood fluctuations and reducing the stress associated with the disorder. Next, cognitive behavioral therapy is another effective treatment for bipolar disorder. So it helps individuals with BD to identify negative thought patterns and behaviors, teaching them how to replace them with more positive ones. It also aids in recognizing triggers for bipolar episodes and provides strategies for managing stress and navigating tough situations. By doing so, CBT enables people with bipolar disorder to experience less emotional distress, engage in more context-appropriate behaviors, and develop more realistic, balanced perspectives. Individuals with bipolar disorder can also express their concerns, discover coping mechanisms, and gain encouragement, which help reduce feelings of loneliness by joining support groups. At the same time, their family members and friends can also learn more about the condition, share their worries, and explore effective ways to support their loved ones with bipolar disorder. If none of the treatments as mentioned earlier works on the patient, or when the patient is unresponsive or has severe bipolar disorder and needs a quick relief, electroconvulsive therapy will then be implemented. Basically, this treatment involves the use of a small electric current to trigger a brief seizure in the brain, which helps improve symptoms by changing brain chemistry. This treatment is also recommended when patients are unable to take antidepressants due to health reasons such as pregnancy.